Artificial Intelligence Doctor, www.abcpharma.net/English. User question: what is the relationship between insulin resistance and prediabetes in elderly people? GPT-4o answer: in elderly people, the relationship between insulin resistance and prediabetes is particularly important because of the increased risk of developing metabolic and cardiovascular conditions as they age. Here's how these two conditions interact specifically in the elderly. Relationship between insulin resistance and prediabetes in elderly people. Higher prevalence of insulin resistance with aging. Age-related decline in insulin sensitivity. As people age, there is a natural decline in insulin sensitivity due to several factors such as reduced muscle mass, sarcopenia, increased fat mass, particularly visceral fat, decreased physical activity, and changes in hormone levels. This decline makes elderly individuals more prone to insulin resistance. Increased risk of prediabetes. Insulin resistance in elderly people is a primary driver for the development of prediabetes. The body compensates for reduced insulin sensitivity by producing more insulin. However, with age, the ability of the pancreas to secrete sufficient insulin in response to insulin resistance diminishes, leading to elevated blood glucose levels indicative of prediabetes. Combined impact of age-related changes. Impaired glucose metabolism. Aging is associated with a reduced ability to metabolize glucose efficiently. Insulin resistance further exacerbates this, as the body's cells become less responsive to insulin, making it harder to maintain normal blood sugar levels, thus increasing the likelihood of developing prediabetes. Reduced pancreatic function. With aging, beta cell function in the pancreas, the cells that produce insulin, declines. This reduced capacity to produce and secrete insulin, coupled with insulin resistance, makes elderly individuals more susceptible to prediabetes. Greater risk of progression to type 2 diabetes. Accelerated progression. Elderly individuals with both insulin resistance and prediabetes are at a higher risk of progressing to type 2 diabetes more rapidly than younger individuals. The age-related decline in beta cell function and decreased physical activity levels can accelerate this progression. Compounded health risks. The combination of insulin resistance and prediabetes in the elderly significantly heightens the risk of developing other metabolic and cardiovascular conditions, such as heart disease, stroke, and hypertension. This risk is greater in the elderly due to the presence of other age-related health issues. Impact of comorbidities and polypharmacy. Coexisting health conditions. Many elderly people have multiple health conditions, comorbidities, such as hypertension, dyslipidemia, and atherosclerosis, which can exacerbate insulin resistance and increase the risk of prediabetes. Medication effects. Certain medications commonly used by elderly individuals, such as corticosteroids, beta blockers, and some diuretics, can contribute to insulin resistance, further complicating the management of prediabetes. Lifestyle factors and their role. Physical inactivity. Aging is often accompanied by reduced physical activity, which can worsen insulin resistance. In elderly people, lack of exercise decreases muscle mass, which is crucial for insulin sensitivity, thus promoting the development of prediabetes. Nutritional changes. Dietary changes due to aging, like reduced appetite, changes in taste, or difficulty in preparing healthy meals, can lead to poor nutrition, further promoting insulin resistance and prediabetes. Inflammation and oxidative stress. Chronic low-grade inflammation. Insulin resistance in elderly people is often accompanied by chronic low-grade inflammation, which is more prevalent with aging. This inflammation contributes to both the development and progression of prediabetes. Oxidative stress. Aging is associated with increased oxidative stress, which can damage cells and tissues, including those involved in insulin signaling. This oxidative damage can worsen insulin resistance and promote the onset of prediabetes. Potential reversibility and management. Opportunities for intervention. While insulin resistance and prediabetes are common in the elderly, they are not inevitable. Early detection and lifestyle interventions, such as increased physical activity, a balanced diet, and weight management, can help improve insulin sensitivity and reduce the risk of progressing to type 2 diabetes. Tailored approach is needed. Given the unique physiological and metabolic changes in elderly people, Interventions may need to be adapted to account for mobility issues, comorbidities, and other age-related factors. Summary: in elderly people, insulin resistance is a key driver of prediabetes due to age-related changes in metabolism, reduced physical activity, altered body composition, and declining pancreatic function. The coexistence of insulin resistance and prediabetes in the elderly significantly increases the risk of developing type 2 diabetes and other related health conditions. However, early detection and targeted interventions can help manage and potentially reverse these risks, improving overall health outcomes for the elderly.